Hello, everyone. I'm Dr. Diana Bitner, and tonight joining me is our new member of True Women's Health, Susanne Pettigrew, our wonderful PA who joined True Women's Health.
Thank you so much for having me. I'm so excited to be here tonight.
Well, thanks. And I'm so excited that people will get to know you a little bit, and I can't wait till they get to meet you in person in the clinic. So I don't know if you signed up, if you knew what you're signing up for with True to be doing all this talking about women's health, but it's really fun to have you involved in all this. So everyone, tonight, I'm just going to go through a little housekeeping. First of all, again, welcome to Let's Chat. Tonight's episode is about healthy aging. We're going to chat about healthy aging. Next week, I'll be with the Spring Lake Library talking about nutrition from the farmer's market. The following week, I'll be joining with Dr. Hibbler, who's the medical director of Clean Juice. So excited to have that conversation and for us to get to know each other and talk about the different ways that we have tools to fit into our healthy lifestyle. Then next week, we'll be talking with Dr. Maria Sophocles, who's visiting from New Jersey, to talk about Mona Lisa Touch and the treatment options for painful sex, especially after menopause and especially for women who suffer breast cancer and can't take estrogen. So tonight, we're going to talk about healthy aging. Please feel free to put questions in the sidebar. We'll see those questions and we'll respond. And certainly if you want one of us to respond, please direct that accordingly, but we'll all just be talking. Tonight, we just want to have a really fun conversation, but I want to kind of review our agenda. If you're tuning in, especially after the live event, you can have a sense of where we're going with this. But tonight, we're going to talk about healthy aging at True Women's Health, what that means. We're going to talk about why I care about healthy aging and why I changed from OBGYN to this. Susanne is going to talk about why she cares and why she chose to join True. We're going to talk a bit about how at True you don't get lost in the big system and how we really have made a great process around you feeling connected to the team and in contact with the team, and really how we get to know each other and connect and support your aging in the way that you want. We're going to talk about the tools that we use. And then, as always, we're going to end with 5 tips for healthy aging and also 5 questions we want you to ask your healthcare provider, especially if you don't live in this area and don't get to see us here at True. So we want to make sure that you're informed of how you can best take care of yourself. Susanne, did I miss anything?
I don't think so. That was very thorough.
Okay, good. So again, I want to start just very briefly with, why do I care about this? And it all goes back to taking care of our patients. I love the saying that us docs, us healthcare providers are kind of like men, sorry guys out there, is that if we can't fix something, we feel inadequate. We like to take care of people. We like to fix stuff. And when women started asking me questions about healthy aging and why am I gaining weight and why am I tired, I didn't know those answers. I could deliver a baby, I could do a hysterectomy really well, but I didn't know these questions. So I went out into the world and got educated and was able to bring those answers back to West Michigan and really start to understand how much midlife and menopause impacts people's lives, but then more and more how this impacts our lives all throughout, from puberty on until the 90s and 100s. So, how we all want to age well. My friend summed it up really well. She said, I just want to keep doing what I want to keep doing as long as I want to keep doing it. So that's why this started. Suzanne, do you want to talk a bit about why do you care about supporting women through healthy aging?
Yeah, I mean, women's health has really been always a focus for me. My basis for my practice, came from primary care. I was in primary care for 30 years, and so before I started practicing in survivorship clinic, and then also working in the Spectrum Health high-risk breast clinic and the Cancer Menopause Sexual Health Clinic at the Cancer Center with you, Dr. Bitner. So women's health has really been a primary focus for me. It's always been an area of interest. And I think, women's health kind of sought me out in a way. It's like I recall being in primary care and being the only woman in an all-male practice when I first started. And so, of course, women want their GYN exam with a woman. So, I was the go-to person. But so my love of this practice probably started way back then. But you see a lot. I mean, in primary care where my practice started, you focus on prevention and wellness and health promotion and how to keep people healthy, but you also see a lot of disease. You see a lot of, what's failed in the healthcare system and how we don't help women very, very much to stay healthy. And this image of this one patient comes to mind. One of the advantages of being in primary care is that you get to know your patients really well over the years, but also, it's a generational thing where you get to meet mom and children, and sometimes you're even lucky enough to meet the grandmother. And so I just have this image of this patient that I was seeing, and the mother was the primary patient of mine, but she came in and her grandmother was with her, and her daughter, the granddaughter was also there. And so, from a physical standpoint, they all looked the same. I mean, they all had, they all struggled with obesity. They all had this round body shape, and they were all a little bit on the sedentary side. The grandmother, from what I learned, was struggling with heart disease and diabetes, and ended up actually having a toe amputated as a part of the complications of her diabetes. My patient, who was the mother, was struggling with pre-diabetes, so a stepping stone to diabetes, and the daughter, struggled with weight and heavy periods, so she was probably in pre-diabetes. And so I kind of look at them and recall, and it's like, well, there has to be a better way. It's like genetics doesn't drive everything, and there's so much that we can do to offer women to make an impact and make that pathway be different. Just because our ancestors had chronic diseases doesn't necessarily mean that we have to make the same choices.
Exactly.
Genetics doesn't have to be our future.
And I love how you describe that, the three women, because a lot of times the woman will come in midlife and say, yeah, my mom has diabetes, she's had complications, my daughter's having those heavy periods, does this mean this is what I have to have? There's almost like an acceptance. Mm-hmm. And I think, I really want to be one of the doctors who makes a difference for women before they lose control. I think a lot mm-hmm. of it's about control, right? Mm-hmm. Do you want to be in control, or do you want your health to control you? Mm-hmm. If women want to have diabetes, I will write their medicines. I will support them. I'll, organize all the doctor's appointments. But if women don't want diabetes, they don't have to have it. And I think that's a new way of looking at things.
Mm-hmm. Yeah, it's somewhat new. I think what's new for us at True is how we approach it, though. Mm-hmm. And it's not necessarily about being proscriptive with patients in terms of threatening them about, gee, if you don't, lose 50 pounds, you're going to have diabetes. It's like, right. Well, that doesn't work. Mm-hmm. It's kind of a fear-based focus. And so it's more about really getting to know, well, what are her priorities? What are her goals in life? What are her fears? What are her barriers? And really kind of working through all those things and really becoming her partner to move forward in accomplishing what it is that she's interested in doing.
And that's why I love how we're limiting how many patients we have, so we can really get to know every patient. And we have all these tools at True that I think are going to really make that possible. That are really going to make that possible. From the minute that people call and sign up and talk to Elizabeth, she gets them on the app. And once people are on the app and filling out the questionnaires, patients have told me, wow, yeah, those were quite a few questions, but it really made me think. And I didn't know some of the family history. I had to go call my mom or my sister or my aunt and really put that all together. And, I when I think about our process with waypoints, and I love how, it really helps us get to know people, but basically instead of the fear-based, threatening with what might happen, we talk about waypoints. And waypoint stands for who am I? Everything we do at True is about waypoints. We're all different. We all have different goals. And then we look at these 9 areas of wellness, and we ask people, in these 9 areas of wellness, where do you want to be? So, each of these wellness, A means ability to be active. B stands for obesity or the risk factors that might go along with different levels of weight. C stands for cancer. And most people don't know there's choices whether or not we develop cancer. D is diabetes. E, ease of coping. F, phase of ovarian function. G stands for good bones. H is heart disease. and I is income security. We at True feel like these are all the 9 areas of wellness that really include all these things that we actually have control over.
Yeah, and looking at healthcare from this perspective is so important. An analogy I would give about a person's health status is, I call it the iceberg model, where you think about an iceberg, it's like, well, the part of it that you see is just a teeny tiny part of it, right? It's like, so that's when you think about health, the tip of the iceberg is your general health status. And for some people, they think they're completely healthy because they don't have symptoms. So the tip of the iceberg is really not revealing. And so when you look underneath the water, then you get to see all of these things,
Right.
whether it's lifestyle, emotional issues, attitudes, other habits, value systems, what's our sense of purpose? What's our meaning in life? And so when you're breaking it down into all these categories, as you've reviewed, it gives us an opportunity to kind of delve a lot deeper.
Exactly.
I just want to mention before I forget is you talked about the information that we get on the patient in the app before the patient actually comes in to see us at True. I'm amazed at what I know about a patient before they hit the door, and I would sometimes even say that I know more about them before they enter the door than maybe I did in my old practice in family practice, where you have 15 minutes to see them, than I did in the entire practice. And so, but it's really pivotal information that in the way you and I practice, at least now, it's like I can't take good care of a patient and get to know them without knowing something personal about who they are, where they want to be, what are their goals, things like that. Using that as a premise to take good care of them.
Well, and I love that whole idea of, we want to get to know women, but more than anything, we want them to know themselves even better. And, by knowing all that information before they come in, again, just to be clear with people, our app is HIPAA protected. We work with a company that is very secure in terms of private information going in through the app. It's not like texting on your phone. This is a very secure medical HIPAA protected app. So once that information is in there, seeing patients this week, we could get right down to what, they want to walk out of. And what I ask a patient always when she comes in is, I get you, you've signed up. I get you for a whole year. Hopefully you're so happy that you sign up again next year. But, by the end of today's appointment, what do you want to make sure you walk out of here with? And I've already got a sense of their goals, but then we together set goals for the appointment. We set goals for maybe the month, the year, and they walk out with a plan. And I'm amazed how many times the question is, help me feel like myself again. I don't understand why I don't understand why I'm tired, why I'm gaining weight. So it's really all of that. When you talk about the tip of the iceberg, that made me think of a patient that I'll never forget. I was in the middle of my busy career as an OBGYN. I was on call at the hospital. I was called to a patient's room for a consult, and it was up on the heart ward, or the heart floor. And usually gynecologists or OBs don't go up to the heart floor. So I'm up there looking for the patient, and I walk in the room. She was around 72 years old, and I walked in and said hello to her. I looked at her chart, and she said, "Oh, not another doctor." And I said, "Well, I was asked to see you because I understand you've had some uterine bleeding, and you're 72, and that's not normal. So we're here to make sure everything's okay." And she said, I just can't believe there's one more thing. And I said, "Tell me, what's going on?" And she had fallen at home and broken a hip. And she came into the hospital in the ER. She had to have surgery to repair her hip. And unfortunately, during her surgery, she had a heart attack. So after her surgery, they put a stent in for her heart, and she was going to do pretty well from that standpoint. And then, of course, she started having vaginal bleeding. And to make a long story short, I did a pelvic ultrasound, I did an exam, and diagnosed her with uterine cancer. So here she is, a 72-year-old woman who has lived her life for her children, her grandchildren. She always cooked lots of big meals. She would, of course, eat her meals with her family, but she never took care of herself. And so she, over the years, had, after menopause, she gained a lot of weight. She didn't sleep very well, so she was always tired, but all the people around kind of kept her going. We didn't know years ago to take vitamin D and calcium. She was developing these health conditions she just wasn't aware of. She was tired, but she just put it out of her mind and kept going. So all 3 conditions that she developed, uterine cancer, osteoporosis, heart disease, were silent conditions until she had the ultimate stress of a fall and a surgery. Thankfully, all these conditions, we were able to treat them and get her out on her way. But unfortunately, she was then, still always going to be at risk and likely to not do as well as she would have if she had prevented. But again, if you don't look for these things, you don't know. And I can't tell you, Susanne, you and I talk about this, how many women we've diagnosed in the last month with prediabetes. Again, if you don't look for it, you're not going to find it. We look for it. Before you even come into True, we've drawn your labs. We already know where you're at. So you walk out of the door knowing so much more about you than when you came in, and then you leave with a plan.
Yeah, and I think the important part is that it's what we do for everyone. We don't just look at people, oh, she must be at risk for this, so we'll screen her. It's a process of we screen everyone with the appropriate screens for them based on their risk level and their age and things like that, and just getting that into how we do it. So the example that you gave is a really good example in that there were warning signs for that gave us clues that was going to happen if we just looked for it.
Like where she carried her weight around her belly, like her fatigue. She couldn't even walk to the mailbox very well anymore. She just thought, oh, I'm just getting old, right?
Absolutely. And some lab values that probably had some indicators. And even just talking to her about what her goals are early on. Everybody wants to feel well. Everyone wants to be healthy. If asked, people will volunteer these goals. But usually in traditional medicine, we don't ask because our hands on the doorknob because our 10 minutes are up. And so, those questions are really important to ask to really get at the heart of where a woman wants to be in terms of her overall health.
Exactly. And that's why I love that we get to spend so much time. Again, we're limiting how many patients we have. And so that first appointment for sure is at least an hour. And we're able to really spend the time. And it's amazing even then how an hour can feel kind of short. But that's where the app comes in so well, because with the app, patients can text us, anytime while we're sitting here. I've had several texts come in. So when we're done with this, I'll make sure and get on the app and answer those. But it's just so fun because it's quick. People have quick questions, or we started a new medicine, or, hey, what about this? So it's a really cool thing. It's like we can be coaches and doctors, and the whole team gets involved.
Yeah, it's really fun. And if you're a patient with us, don't be surprised if Dr. Bitner or I just send you a note checking to see how you are. It's like, imagine that you'd actually get a text from your medical provider.
Yep. And what I love is I'm very picky about who I send my patients to for, referrals. If there's an issue about bone health, if there's an issue today, someone really needs their knee looked at by an orthopedic surgeon, I have very specific people that I know get how our patients are. They're women, different than men, how hormones play a role. We interact with very specific physical therapists. We interact with very specific providers. And then we follow up. Jill will give you a call. Hey, how did that appointment go? Did you get the answers you needed? I'll make sure I get a note back from that provider and make sure we're working together as your team. So, you can have lots of services available, but if we're not using those services in a way that supports your goal, then, it's just, one more service. And Dawn, I see you're asking a question. How do you get the app? You get the app if you join True. So once you join True, and I'll go through the 4 programs in a minute, but that app is available that you can, again, communicate with us. You can do a telehealth visit even over the app. And of course, the other cool feature is that you get to track your symptoms and track your habits. So one of the things that we talk about a lot are the seeds, or the 7 essential elements of daily success. And truly, everything goes back to the seeds. It goes back to those basic habits. And there'll be a link up. You can switch out and look at, on our website, we have those 7 essential elements. And on the app, you can track if you're doing those, and it's just real quick. The other thing that we track, Susanne, do you want to talk about the MTS?
You can cover that.
Okay,
MTS
cool.
is a scale that we use that looks at, or I will.
Okay.
that looks at menopause symptoms. It was created by Diana. And it's a simple, fun tool that makes it really easy to rate your symptoms. Symptoms like, sleep issues, hot flashes, sex drive, things like that. And the wording on it is just kind of fun and interesting. It's the rating is, I can't remember, is it 1 to 3?
3 is good, 1 is bad, essentially. And I developed this with patients, in terms of back in 2008. So patients helped me develop the language, and it's just really straightforward. The weight, 3, 2, 1, a 3 is either my weight's good or I'm overweight and losing. A 2 means I'm overweight and not losing, or I'm at a good weight and gaining. And a 1 is I'm overweight and gaining. So it's just real simple. And so, energy is I wake up ready to go, mostly good days. A 1 is mostly bad days. Libido is either I'm not having sex and I'm okay with that, or I am in a relationship where it's fun and we're connected. A 1 is it's bad, we fight about it, or I'm not having sex and I want to. So, it's just really easy language. And on the app, you can track those, the seeds and the symptoms. So again, once you're a patient at True, then you can get onto the app and then we can see.
It's a really nice tool because it makes kind of tracking how you're doing really concrete, because sometimes you'll ask someone, it's like, well, how are you doing? They're like, I don't know. I don't remember how I was doing last time. So it makes it really concrete where you're actually rating yourself.
And I love the company that built the app for us. I said, I really want the seeds and the MTS on the same screen. And at first they're like, I don't know if we can do that. And they figured it out. They programmed 3 screens in 1 screen. So now you can see both things, on the same screen. So for example, you start having more hot flashes, you track your symptoms or your habits, and now you're not drinking enough water. Or you had 5 treats because you were on vacation. You had wine and a brownie and a s'more and, whatever. Oh, okay, no wonder I had a hot flash. So it puts you in control of how you feel. So that's what's really fun. So I want to talk about the 4 programs. So we've had a lot of feedback from our patients. We started with 2 programs, we've expanded to 4. So our 2 main programs are basically our wellness program and our concierge wellness. And what that means is there's a different level of, involvement and interest. So, and we use a different model. So, the wellness model is you pay upfront, and then when you come in for a visit, you are also billed at that time for your visit, and you can get a receipt and return it or turn it into your insurance company. But for that membership, you get access to us, you get use of the app, and we hope you see us at least 3 times during the year, if not more. Again, this is not just a GYN visit, an annual exam, and a pap smear. This is a wellness visit where we really get deep into the weeds of who you want to be, how you want to be, and then we support you on that journey. The concierge program allows you to come as many times as you want. We have a patient, with some more acute issues. She's seeing us every week, either on telehealth or in person. So we're really able to connect without thinking about how many times we're connecting. And of course, use of the app. We also have Chef Anna, who's on staff at True, and so she's available for nutrition consults. And again, it's that wraparound care and that one-stop shopping. We have the flu shot, we have shingles, we have, all that basic stuff that you might want to, get if you have a cold, if you have a bladder infection. We're available to see you for an urgent care visit, which then brings me to the whole question about primary care. I am not an internist or family practice doctor. I'll always tell you if I don't know something, but we really together can handle the basics. Susanne did primary care for many years. She's taught me a lot about that, and we really will make sure we're up to date. And again, we love it, right, Susanne, that we get to take care of the whole woman.
Yeah, and it takes a team. I mean, our goal is to take care of the whole woman, but we admit that we are not experts at everything, and so we will form a team of specialists who we plan to work very closely with. So when something's out of our league, we will discuss that with you and get you connected with someone who can handle that problem. And if a patient already has a primary care provider, our goal is not to replace them, but to work very closely and just become another part of your team to take the best possible care of you.
Exactly. And recently had a patient who just loves her gynecologist. And of course, we'll support that relationship. We're not looking to replace a provider that you might already have, but add to them in the sense of, many gynecologists are very comfortable with female issues, place an IUD, do a procedure, do a DNC, but maybe, they haven't had that additional training in menopause and, wellness in this time. So again, we can work together. And that's what makes this so fun, is that we all have our areas of expertise. And I just think it's so important. So for example, Susanne and I have both had more training in sexual health. Susanne has had a lot of training in background in high-risk breast cancer, in cancer survivorship. So again, we practice in our areas of expertise.
Absolutely. Absolutely.
So it's fun. So from feedback from we did a lot of early Zoom calls and with lots of women talking about, what they were looking for and what they need. And many women said, I really want my daughter to see you. I don't think she needs the whole membership or doesn't need the app. But I want her to see you for her first wellness visit, so she can kind of start thinking in a different way about her health for her whole life. So we started the Empower program, which is for women 25 and younger to come in and see us for a one-time payment. Again, we don't interact with insurance companies in the traditional way. So they come in for that one visit. And I had a 19-year-old girl the other day. She was so nervous. It was her first visit with a woman's health specialist or a gynecologist, anyone else than their pediatrician. And she was so nervous. I walked in the room and and by the end, she was like, this was so fun. I talked about things I didn't think I could talk to about with.
She was lucky to have her for her first exam, because it's a very unique way that we approach patients. It's not the routine rote GYN exam, for sure.
Yeah, exactly. And, plus I love at True, we create this environment. It's a, spa-like environment, but very professional and very, just very straight. I don't know, how do you say it? Simple, but, it's just very comfortable. And the chairs that we have are very comfortable. They have heat and massage in them, actually. And when I pull out the stirrups, sometimes people are like, whoa, where did those come from? So it's just a very comfortable environment that doesn't feel like a scary doctor's office.
It caters to what women want. It really does.
What I would want, right? Like golden rule. Like,
sure.
And then the other program is called the Silver Wellness. So again, True doesn't participate with Medicare. We don't participate with insurance in the traditional way. But we have many patients who want at least that one visit a year with a woman's wellness specialist. So we see patients 65 and over for that one visit a year with, follow-ups as needed. But she'll come in and we do a summary of her wellness at this time. And again, I've had many patients who see us for the Silver Wellness, and then they end up, signing up for one of the memberships because they really do see how we're different.
I want to put in a plug for the concierge part of it. It's really our premium, package, of course, but to really take full advantage of everything that Dr. Bitner and I provide, the concierge package really is the avenue to get that. For example, there's a patient that Dr. Bitner and I actually saw together for her first visit, and then she has a lot of really interesting things that we want to work through, and so we're going to do regular telemedicine visits for a bit, and so we don't have any limits or boundaries on exactly how many times we can work with her. And so really to get the optimal outcome, particularly if you have some concerns that you really have been struggling with for years and years, and you want to work through, that's going to give you the optimal outcome.
Yeah, I had a patient recently. She's like, wow, there's a lot more to this than I thought. She said, I really need to change up to the concierge because, she said, for years I've been, asking a question and I might get a quick answer. And turns out it's lichen sclerosis. It's not just an abrasion. They're like, just don't have sex for a week and it will be fine. And on exam, she has lichen sclerosis. And this is why she's been having painful intercourse and a lot of, discomfort down there. And so, we're able to really get to that and now follow up on it and get her feeling her best. Other issues with, again, symptoms of menopause or, again, low energy, weight gain, we can really do that deep dive.
And those are really super common symptoms that women, particularly in the perimenopause and menopausal age group, have. But women of all ages, have those concerns. And so, just to get the most from what it is that we designed and offered, that's the Primo package. But we have those other packages so that all women, have potential access to our care. That's our goal.
Yeah. Another tool I want to talk about is the sex deck. So the sex deck, I had a patient the other day who had some concerns about her sexual health. She was feeling like she was broken, or there was something wrong with her, that she just didn't think about sex anymore. She was just getting into menopause. She really liked her husband. She loved her husband. She was attracted to him. They had a good relationship, but they were both super busy with their lives. They had aging parents that needed them. They had kids that were, especially, and then with COVID and job stress, but she just felt like, I don't want to have sex, and I feel like there's something wrong with me, and I don't want my husband to think I don't care about him. Mm-hmm. And so I said, I'll be right back. So I went and got the sex deck, and the sex deck is a card game with 27 reasons for low sex drive. And she's like, wait, I just thought it was an on and off switch. I'm like, oh no, there's lots of components. And so we started going through the cards, and they're divided into physical, psychological, and interpersonal. And the physical ones for her is that she did have some dryness and pain. Her bladder would leak sometimes during intimacy, and she didn't like that so much. Who would? She felt like she had gained some weight, especially in her middle, and that made her feel really not attractive. He didn't care, but she cared. And she was really tired. She was going to bed too late, getting up too early, not working out, not eating as well. And so she was just really exhausted. And her husband was worried about work. They just didn't have that time to connect. And so right there were 6 things. And so she was so excited to take that sex deck home with her and go through those cards with her husband and say, look, this is stuff that we can get a handle on. It's not that my switch is turned off. It's not that I'm broken. There's things that we can address.
It's a wonderful tool to use in the office for you and I, but I think to use as something that you use at home with your partner, it's just a really nice way to open the door to the discussion, because a lot of women are like, well, what do I say? How am I going to open the discussion? And, he's going to feel bad. I'm going to feel bad. And, it's just a nice way to be able to open the communication gates to
right.
have
and sometimes
discussion about a really important topic.
And just sometimes husbands will come in and they're like, oh my God, I was so afraid to bring this up, or,
and they're relieved.
They're so relieved. Everyone's been thinking about this. It's not like, this isn't something that both people are aware, but nobody knows how to bring it up because, again, people are afraid of hurt feelings. And, the guy would say, I was so afraid I was going to get in trouble, or I was afraid she thought I was being pushy, or, I just want to connect with her, and then, having a conversation like, what is sex? It's intimacy, it's pleasure. It doesn't have to be defined like it was defined, 20 years ago.
By our ancestors, yeah.
Exactly. And then, too, in the office, we offer a couple of tools as well. So, for example, the Millie is a dilator that can help people with high tone pelvic floor dysfunction. So that pain that happens because of tight muscles, or because you had hip surgery or surgery for endometriosis, it really leads to a lot of tightening of the pelvic floor muscles. And so we have Millie right in the office. We have other dilators. And then the other thing, Susanne, do you want to talk about Mona Lisa Touch? Is so exciting.
Mm-hmm. Mona Lisa Touch is a laser therapy that we recently started doing. Both Diana and I are trained to do this procedure. It is used primarily to treat menopausal changes in the vulvar and vaginal areas, things like vaginal dryness, pain with intercourse. Some urinary problems will inadvertently get better. It's a really wonderful tool, particularly for cancer survivors who have estrogen-dependent cancers, who maybe can't take estrogen or are uncomfortable using the vaginal forms of estrogen as an alternative. So that specific population is a population that really could benefit from this procedure. So we are providing that service at True right now. We would schedule a consultation to evaluate to make sure that you're a good candidate. It's a treatment that involves 3 consecutive therapies. It's from the feedback that we are getting, the procedure is not uncomfortable. It's just a mild sensation, and women leave the office quite comfortable. And one of the treatments that we were doing, you can almost see the tissue healing as you're doing the treatment. So it's a wonderful procedure to be able to provide to our patients as another option for treatment.
Yeah, I feel so good about it because there are a couple different lasers on the market. This is the only laser that has any data around its true efficacy. I don't want to offer something that we don't have good data on. So it's a CO2 laser, and it has a very unique way of getting at the tissue, but providing, healthy tissue around the areas where the laser sort of, I hate to say, zaps the tissue, and it creates a healing process. But it does it in a way that there's columns of healthy tissue as well. And one of my favorite studies about the laser is called the Velvet study, and it shows that the laser is as good as estrogen. It's not better than estrogen, it's as good as estrogen. So for a woman who's already on estrogen, the laser is not going to make any difference. We're not going to take your money. It's a procedure that provides an improvement to the skin related to low estrogen. And so we feel really great that we're offering the one laser that has really good data behind it, and we know that it will be effective in treating the skin. So I love that. So good. So I see a question by Jill. So the question from Jill is about telehealth. Would you see patients like this via telehealth? There's definitely, since COVID, there has been a lifting of restrictions around telehealth, but we have to be very careful. Susanne and I have licenses to practice medicine in the state of Michigan, and there are several agreements with the state of Michigan with other states, especially in the Midwest, that we can provide telehealth services across state lines. But for that first visit, if someone is across state lines, it's really best to see someone first in our office. And then if they're traveling out of state and their main residence is in Michigan. So there can be some really logistical issues around telehealth, but we do have that platform for the patients who have started to see us, at least in person once. The other consideration is that if you were to go on the website, menopause.org, you can find a certified menopause provider in your area. If your friend is out of state and is looking for a provider, even if the issue isn't specifically menopause, what this means is that the provider who has this certification really knows about gender-specific medicine. They know about how a woman is different than a man, and the test is not easy, to become a certified menopause practitioner. It's a lot of internal medicine, bone health, thyroid health, and mood changes that occur because of hormone fluctuation and aging. So it's a really comprehensive exam that one has to really learn about and study for. So again, if your friend lives out of state and is not able to contact us, we can't work out those logistics, there generally would be a provider in her area.
So the bottom line is we're saying that it's optimal to do the initial visit as an in-person visit, but the follow-up visits, there are ways that we can make that work that's reasonable, right?
Exactly. Yeah, recently we've had patients from out of the country visit us.
Yes, absolutely. We were thrilled to be able to provide those services.
We were thrilled. And again, I just can't believe that I get to do, it's so much fun. I mean, this is too what I want every woman to do, to live her truth, to be living her life connected with what she loves to do. And I'm so fortunate. I'm living my true life. I get to take care of women. And again, there's nothing like seeing the light bulb turn on, that aha moment of patients saying, wait, I get to choose how I age? I had no idea. Whether it be a 19-year-old, whether it be a 99-year-old. I had a patient the other day I sent to physical therapy because she was 75, and she was like, yeah, I'm just getting older and I'm whatever. I'm like, you're only 75. You're acting like you're 95. What the heck? Let's get you to physical therapy. Let's get you moving again. And she was like, what? I'm acting 95? I'm like, yeah, actually you are. So it's really fun to see people have that aha moment and say, I don't have to just choose this, or I don't have to live like this. I can choose, to act like I'm 50, which reminds me too, we have the, I don't know what you call our scale that we have in our office. So, I remember people saying, saying that, I've lost, I feel like I've, been working so hard, my clothes fit better, but my weight isn't changing. So at True, we have a scale that measures body fat percentage, muscle mass percentage, as well as, of course, BMI, and then calculates your visceral fat, which is the fat around your belly that definitely shows, and if you have more visceral fat, then there's more risk for things like diabetes and heart disease. And then it also calculates a body age based on muscle mass and visceral fat. And sometimes that's really good news. I had a patient the other day who was 75 and her body age was 54. She's like, I can't wait to tell my husband that I'm really 54. And but then sometimes it can be very shocking and eye-opening when someone is 50, but their body age is 80, based on those same sort of numbers. And so it can be a real eye-opener and something that really gets people motivated.
It's fun information to have. And I find that patients get kind of callous to the cholesterol and all these things that we've been hearing about all these years. And this is kind of new, fun data that really seems to be a really effective way to get people to notice and to motivate them to make behavior change when they're wanting to do that.
Exactly. I always think about like all the magazines in the grocery store line, what are they, on the cover? All these quizzes, like what kind of person are you? What kind of best friend are you? What kind of mother are you? We get to say, how do you want to be when you're 60, 70, 80? And let's figure out where you are now. So we actually do these evidence-based health tests or quizzes to figure out and use all your numbers to figure out actually where are you? And one of the tools that we offer is something called a life map. So basically it's mapping out where do you want to be versus where are you now? And if you're not where you want to be, how can we help you up your game? Or maybe you choose to lower your goals. I hope you don't do that. But it's mapping that out, and then people can really see where they are now versus where they want to be in the future.
And most people go through most of their lives not even thinking about a map. And it's a little bit like if you're going to get in your car and drive to California, you would never leave without a map, right? Or at least have your smartphone to get you there. And so this life map is a little bit like that. And one of the reasons why a lot of us don't accomplish what we want to is because we never really thought about what it was and define how it was that we were going to get there. So these are really important ways to look at our health.
I love it. I just looked at the time. I can't believe we've been talking almost 45 minutes. Hopefully you're all still here with us. We're having fun. But let's get to the 5 tips that we want people to think about with healthy aging. So the first tip about healthy aging is what we just talked about with a map, is identify what's important to you. What do you want? What did you see other women in your life maybe not have, and that, or was it that woman you saw still running at 70 and you're like, I want to be like her? What really is important to you? I have a lot of women who say, I want to get down on the floor and play with my grandkids. I want to be that cool mom who's still going skiing and horseback riding at 60. So we want you to define your picture of self. So it's really fun to hear patients say, my son's getting married in a year. I can really picture how I want to feel on that morning when I wake up and it's my son's wedding. I want to feel energetic.
It makes it really personal, and it really helps patients to kind of own, why they want to do something.
Perfect. All right. Tip number 2.
Focusing on wellness and prevention is the key here. And so, wellness and prevention, the thing I always think about is, so many of us define ourselves by our genes. Well, it won't make a difference because my father, died at an early age of heart disease. Well, I always remind people that genes are only like a part of the story. Genes have like brakes and accelerators. And so, they have to be in a fertile, encouraging environment to really manifest themselves. And so if we really work hard on diet, lifestyle, and environmental factors, we can put the brakes on genes and really make a big difference in terms of lowering risk, even though there's a family history that we think we're destined towards.
Right. Well, even just what I've learned so much from you about, cancer risk. So many women will say, well, my mom and my grandma both had breast cancer. I guess I'm just going to get it. I'm like, well, no, it doesn't mean you're going to get it. And by the fact of us knowing that, we can screen you a lot different. And therefore, if you were to get breast cancer, we're going to catch it way earlier. So it doesn't affect the quality of your life like it affected your mom. So we do very intensive screening for women's cancer risk. And then we do additional genetic testing. We work very closely with a company, Natera. We are able to order genetic testing right from the office. We draw your blood, we send it off, and we're able to really give good information about your risks and then what we would do different. So again, one of the many reasons why I'm so glad that Susanne has joined the True Team, to really be able to take advantage of her expertise. All right, tip number 3. You want to take this?
Sure. Learning ways to lower risk for chronic disease. And so diet and exercise are probably the biggest thing. Diseases like diabetes, heart disease, cancer, arthritis. As an example, diabetes, if you lose 7% of your body weight and exercise 30 minutes, 5 times a week, you can potentially lower the likelihood that you're going to get diabetes by 40%-ish. Okay. That's really significant. So, working to learn about ways to lower the likelihood that you're going to have these chronic diseases is really important, and it's possible is the thing.
It is possible, and we have the workbook. So every patient that comes in will get the book and the workbook, and the workbook walks you through those stepwise processes, what to do about each thing, and it's written right there. So yeah, at your visits, we cover a lot about the ways to lower risk. But you don't have to leave the office and say, wait, what did she say? You've got the workbook, you've got the app. So you get to be reminded daily with the app, with the workbook of what it is. So it's fun to keep you engaged. All right, number 4. This is near and dear to my heart. You've got to be your own advocate. I hate it when people say, well, I said I was tired, it wasn't followed up on, and you've got to be your own advocate. You've got to be bossy. You've got to be sassy. You've got to say, I'm not okay with this. I'm not okay with living my life tired. There has to be a reason. I'm not okay with hot flashes. I'm not okay. I had a patient who had a history of breast cancer, and she thought, I was told this is just kind of, I'm always going to have pain with sex. I just need to deal with it. And she was told by a provider, I don't mean any disrespect, but she was told by a provider, maybe you can find other ways to be intimate with your husband. You're just not going to get to have sex anymore. It doesn't have to be that way. So be intentional and let us help you develop a plan. Okay, number 5.
And have partners in healthcare who listen and empower you. I mean, this is really key. I mean, we at True are all about being your partner in your healthcare to help you to learn what it is that will guide you in the direction to help you to accomplish your goals, and we'll help you look at your barriers and figure out ways to try to overcome those.
Mm-hmm. Yeah, a patient who, she wasn't going for walks at the end of the day because she was just tired. Well, first of all, it was that glass of wine at dinner that didn't help her feel motivated to go for a walk. But she also had lower back pain, lower hip pain. I sent her to my favorite physical therapy group, and she's been in physical therapy now for 3 weeks. And they looked at how she sits, how she walks, how she sleeps, crosses her legs, and gave her very specific exercises. So in 3 weeks, she has less pain, and she's already been going for walks every night with her husband, as well as not having that glass of wine at dinner that makes her sleepy. So it's looking at all those factors together. So we listen, and yeah, we want you to be in charge of your own health. All right, so let's talk about those 5 questions we want you to ask your healthcare provider. So number 1, what health problems am I at risk for? So again, we break down wellness into those 9 areas of wellness, and we organize it in those 9 ways. But again, it's really looking at your family history, looking at your habits, looking at your physical exam, your labs, and then talking about what you're at risk for. So something you could be able to ask your healthcare provider, what am I at risk for? And then to have the time to figure that out. Tip number 2, or question number 2, is asking your provider, what can I do to prevent them or lower my risk? So again, it's having that time, it's having that plan. Again, it's not, we don't want you to get lost in the system of, oh, we're going to order a test or a referral, and then there's not a whole lot of feedback about what to do with that information. I remember, years ago getting my own physical, and I'd get a postcard with my lab results on it, and I would be like, okay, my cholesterol is a little higher. What are we supposed to do about this? And there was no plan. So again, it's knowing what to do to prevent your risk for these chronic conditions. Okay, number 3.
And what are the lifestyle choices that I make that can...
You got a little tick.
Excuse me.
I'm sorry.
Yeah, why don't you take this one?
Okay, so what are the key lifestyle choices? So again, everything goes back to seeds. You know, the number one treatment for healthy aging is a healthy lifestyle. And again, it can seem confusing or what really matters. And I would argue that the more seeds you're doing of the 7, that is going to most impact your health. Not just your health, but how you feel every day. So the more of those seeds you're doing, drinking your water, limiting your treats, eating your complex carbs, getting your sleep, doing your meditation and your gratitude practice, those are the choices that are going to make a difference. But again, it's being able to ask your provider the questions and get answers that fit into your lifestyle. So question number 4.
Asking your provider, well, how can you support me in making lifestyle choices? I think one of the keys to finding a provider that you can really work well with is knowing that they're going to be able to offer you tools and other resources to support you to move forward. Sorry, I had this frog in my throat all of a sudden.
Are you a frog?
Yeah. And so, you're with the right person, who's going to be able to assist you through this. And so we've given you lots of examples today about, the tools that True has to really make this healthcare journey a good one for you.
And number 5, how does my stage of life affect? So again, this is near and dear to my heart because so many women have changing periods or, symptoms that don't make sense until they know that, oh, this just fits perimenopause. This fits menopause. This fits, late reproductive phase. Why am I having worse menstrual migraines? Why am I having more PMS? Well, it's because you're in late reproductive phase. And so it's important that you have a provider who understands how that stage of life affects your wellness or your symptoms. That is just so important. And so, we help you figure that out. The first thing that you do once you're on the app is to go through some questions so you know what stage you're in. To me, that's number 1. I remember one time being with a friend at a football stadium, and I said, what if all women in the stadium knew what phase that they were in? How would that empower them to maybe make different choices? That'd be pretty cool.
Your dream come true, right?
That would be my dream come through. So, tonight I just want to thank everyone so much for joining our Let's Chat about healthy aging. I am so glad that you got to know Susanne a little bit more. I look forward to you seeing her in the office. We work together every day. We love this dance of how we get to take care of our patients together, how we know our patients so well. We have a team area in our True office where our nurse and Jill, who does referrals and keeps us all in the right place, and Susanne and I are all in the same area. So we're interacting and talking and making sure that everybody gets what they need. So I just thank you so much. If you have further questions, I really encourage you to go to our website, truewomenshealth.com. Feel free anytime to give Elizabeth a call at our phone number. She'll walk you through the website if you have questions about our specific programs. And we also welcome you to ask to come in for a tour. Of course, with COVID, we want to make sure we've got people, we wanted to have big parties and opening receptions, but of course, in these times, we're not able to do that. So we really want you to feel comfortable to give a call, schedule a time to come in for a tour. Usually there's a time where Susanne and I are around and we can say a quick hello, but we can just show you our space and talk a little bit more right in person with what we offer. Again, feel free to visit our website, check out, we're very active on our social media, Instagram. If you have a picture of yourself in a menopause moment, put it up on Instagram and tag True Women's Health. We really look forward to sharing your journey. Susanne, thank you so much for starting, joining this new venture of True. We're so lucky.
Thank you so much for having me. It's an absolute thrill so far, and I'm so looking forward to this journey together.
Great. All right. Thank you, everyone. Have a good night.